Welcome back, everyone, to another episode of the Health Made Simple Show. I'm your host, Dr. Barr, and today I have a great episode for you. Today, we're going to do what I call some clinical insights. The clinical insights are insights that I have while I'm practicing that as I'm going through it, I go, oh, yeah, this would be perfect. I'm going to share this with as many people as I can because this comes up all the time, and is probably very valuable for someone to hear the actual conversation behind this particular situation, this conversation that we're having. So I'm going to share with you some very specific things that take place in clinic that I think will be beneficial either to you or someone that you know. So keep doing your thing, keep sharing out, keep spreading love here. And of course, while I go through this, I'm going to do my absolute best to keep the patient confidentiality as real as it can be. Although I'm going to keep the case pretty real. I'm gonna give you all the data and the stats that go with it when you hear these, the conversation that goes with this. And I'm gonna change the name and the dates and the ages and whatnot. So, all right, with that being said, let's dive in. So I'm gonna give each one of these cases a little bit of a name as well, because I think it kind of gives an overlook of how and why we're looking at it. So case number one, we're gonna call this the know what's coming case. The know what's coming case. So this is a case of a 32-year-old female, Donna, and Donna is on her second baby, and she has a 12-week-old baby. And she's been getting adjustments through her pregnancy, through her first one and her second one. It was fantastic, super safe, makes things a heck of a lot easier for the women out there. So if you know anyone that's pregnant or you've been through pregnancy, you're about to get another one, go see your chiropractor. I promise you it's going to make your pregnancy and delivery a lot easier. Anyways, so during this time, Donna shares with me that she's no longer feeling like herself. She's starting to experience things she hasn't really experienced before, not with the last baby. And so this is all new to her. She's starting to really feel melancholic, disinterested. She's gaining a little extra weight. The weight's not coming off like it used to. In her words, she's like, I'm not a depressed person, but if I was, I would probably describe this as some depression. And I don't really know what to do about it. I've never been here before. And there's a lot of other symptoms that go with it. So technically, and I don't like labels, I don't like calling things any particular thing, but this is often what they call postpartum. And this is why I'm calling this case Know What's Coming. Listen, ladies, whether you are about to or thinking about having a baby, when you do have a baby, there are a lot of things that take place in the body I think we overlook. And one of them is that you become massively depleted. And this is at the root cause of postpartum. So I'm going to give you a solution in just a moment here, but I want to kind of anchor home why we see this so frequently. So number one is this. So one, the body goes through a tremendous amount of stress. So this is a combination of a group of stressors all happening at the same time. And here's the thing. The first thing that I told Donna is this. Donna, listen, there's nothing wrong with you other than you are out of balance. So, and that goes with any time we have an anxiety or depression. You're out of balance. There's nothing wrong with you. Just the fact that you're out of balance, you're having certain physiological changes. And as a result of it, it's driving even your mind, how you think and the actions that you're going to take. So let's just unwind that a little bit. So to help Donna out, I walked her through what she just went through. She grew a baby in her belly for the second time. And usually it is the second baby that's a lot more difficult because the mom is more tired because she's been raising another child for the last, maybe year, 2 years, or 5 years. So anyways, second one's typically a little bit harder, no big deal, as long as we know what's coming. So again, name this Know What's Coming. Emotionally, probably a little bit more drained, sleep deprived, absolutely. Stress higher, absolutely. And the capacity to handle things absolutely has now lowered. And then the one I probably didn't mention yet, but nutrient deprived, absolutely positively. And one of the things that we'll see is that the mom will start to crave things like carbohydrates and sugar. So what happens is instead of calling this depression and thinking that this is a pharmaceutical cure, because it's not, that will never fix what's really taking place here. What's taking place is the body, the biochemistry of the body, the neurophysiology, the nervous system has become out of balance. The physiology of the body is tired. And as a result of all these things, we're seeing abnormal behaviors. And I would argue that they're not abnormal for the given circumstances. I think these are normal behaviors for what the body is going through. So how do we unwind this? No doubt we got to get the nutrition on point. But I will tell you, number one, and this is the reason I'm bringing this case up, anyone out there, you're pregnant, you're about to have a baby, you're thinking about baby, the number one thing for you to support immediately after delivering your baby is your adrenal glands. Yes, your adrenal glands, your adrenal glands, your adrenal glands. These are your stress regulators. They are going to determine your capacity to handle different stressors. And trust me, you have a lot of stress going on. Your body's going through massive change. It's, to some degree, you can almost say it's traumatic to the female body when they have a baby. So let's not downregulate or forget, even though people are having babies every day. I think sometimes we take for granted what the female body goes through when you go through a delivery, the labor and all of the other things, the exhaustion, never mind the emotional, changes that take place, or kind of heaviness with the body's going through change and whatnot. So in the event you've experienced postpartum, know this: the answer is support your adrenals first so you can better manage the stressors in your life. And that'll support your endocrine system. That is your hormonal system. So yes, are your hormones going to be a little bit out of whack when you're nutrient deprived, when you're sleep deprived, when your stressors are higher? Absolutely. That's what hormones do. They're going to adapt to your environment. They're going to adjust accordingly, meaning what are you doing to your life? So in this particular case, we're saying know what's coming. If you're about to deliver a baby, you're thinking that down the road, the number one thing you're going to do is support your adrenals. I typically will use two things. One is a product called Drenamine. And think of Drenamine as a product that actually feeds your adrenal glands. This is going to give the vitamins and nutrients, the minerals back to the actual glands, so they have the tools to try to keep up with you and your new life. And then the second part of that is going to give you an herbal component, something we call the adrenal tonic. Phenomenal tonic. It's actually magical. There's 4 different herbs in there. Echinacea for the immune system, which is phenomenal. Licorice root. Licorice is just an amazing tonic especially for females, really for anyone, for me, females specifically. And then ashwagandha is in there, which is going to help you regulate thyroid function. Ashwagandha is also good for cortisol regulation. And then there's another herb called Romania, which will actually help stabilize and repair and increase function of any adrenal dysfunction you may be having. So those two things, adrenal tonic and Drenamine, are really the answers. The moment you have your baby, make sure you're supporting your adrenal glands so you have the opportunity, the capacity, the potential to be the best mom that you possibly can. That, folks, is without even addressing, if you are nursing, all the minerals and vitamins you're going to be losing. So adrenals first, and then, of course, we're going to make sure that we're putting real food, whole food into the body on a regular basis. All right, so that's case number 1. Know what's coming. I think that's an important clinical insight because we see this all the time. Postpartum is something that's big out there, and it's made almost like an assumption that this is normal. It is not normal. It tells the body that we are out of balance, and it does not mean you need pharmaceuticals to fix it. Quite frankly, the fix is from the inside out. Support your body the way that it wants to be supported, and you'll be amazed at how powerful your body is getting through these things. All right, number 2, we're going to call this the case of don't blame the good guy. Stop blaming the good guy and all the different problems and things that show up. So this is a 68-year-old female. Her name is Lisa. We're going to call her that. And there's 2 parts to this one. First part I want to talk to you about that Lisa recently went on a new protocol, like a vitamin supplement herb protocol. And so she came into my office, and some of them I supported with her and some I did not. But nonetheless, they were all looked pretty good to me. And said, Doc, what can I do about this particular one? I believe by taking this, it's causing dry mouth, and it's really, really bad. So I came off of it. In fact, I came off all of my vitamins and supplements because I started to have dry mouth. So I paused, and I kind of looked at this and go, oh, interesting. Did you consider by chance, it's wintertime right now, so I just throwing these things out because we're always trying to look for the root cause and make sure we get to it. Did you consider by chance the fact that the heat is on right now and it's a little bit colder months and whatnot? There's other dialogue that goes with this, but any other considerations like the heat or possibly that you drinking a glass of wine every night? And there was a lot of denial that goes with that. So when it comes to our lifestyle stuff, it's very common. This is why I'm bringing this particular clinical insight to you. We often just overlook and kind of in oversight look at our personal lifestyles because that might mean that we have to do a deep dive, check up, man up, woman up at looking at what we are doing with our day-to-day bodies and our minds and our time and our energy. Like, what are we doing that's habitual? Whether it be good or bad, is there a possibility that some of the things that we do might not be good for us? And the reason I'm labeling this one as don't blame the good guy, because what she did was came off all of the things that are probably the best things for her. We went farther in the conversation, and I said, did you consider coming off the wine which we know alcohol dehydrates the body. Did you consider coming off gluten, which we know that gluten absorbs water, holds and creates water retention, not in the tissue, but it dehydrates the body and puts it and kind of binds it up. So you have essentially an electrolyte imbalance. In both of those, in that moment, just be honest, because you guys don't know Lisa, the answer was no. And those didn't look like options that she was really favoring. But then did ask me, is there something else I could take? And I, as a practitioner, for all my practitioners, I want to tell you, be careful here, because we don't want to all of a sudden just become a pharmacy and become kind of a medicine cabinet where we're saying, well, this didn't work, so we're going to try something else. And the answer is always from the outside in, because the honest question and the honest first look should be from the inside out. What does our lifestyle look like? Can we make inexpensive, essentially no expense to it, of just making some lifestyle changes? Maybe she drinks some more water. Maybe she takes some of the things that are dehydrating her out. So in this scenario, she didn't take that route and then asked me for additional. So I did make her a recommendation, and I was hesitating on whether or not I should make her another recommendation, but I did. And there's a new product we've been using that Standard Process made, and I absolutely love it. I haven't talked about this at all. In fact, I probably use it almost every day right now, and it's called Power Mix. I believe that's the name of it. It's a green drink. Some of you are familiar. There's one that's advertised nonstop called AG1 that's out there. Great product. I've tasted it, tried it. Not a real fan of the taste or anything like that, but a good idea to have just like a green drink you can just mix up with water. So this is what that is. It's just, I will tell you, it's probably 10 times as good, quite frankly. No, it's not going to be marketed on every single, TV commercial and podcast that you see out there. But so it's called Power Mix. Anyways, my point being, if she's dehydrated and she's getting dry mouth, I wanted to help her with electrolytes, make sure she's getting good nutrients in, knowing that her diet might not be so good. So I said, I got something simple, a simple solution for you. All you need to do is put a couple scoops of this in some water, stir it up, and drink it. And immediately, absolutely not, Doc. I can't do anything green. Oh, okay. So to this, I'm going to say, one, don't blame the good guy. Do not blame the good guy. If you start taking a new supplement, new vitamin, new herb, and all of a sudden you have a symptom of something, don't necessarily automatically think that it was because you started taking a new supplement. There could be other lifestyle challenges or lifestyle, habits that you have that could be the problem first. So if you haven't removed alcohol, you haven't removed gluten, you're staying up late, you're staying on your phone, you're having, emotional gymnastics with your mind every single day. Look at those things first, and then look at the good guys and see if there's a possibility you need to remove them. Are there sometimes some reactions to certain herbs? Yeah, sometimes, but it's minimal, folks. I promise you've been doing this for a long time. The reactions to herbs are very, very minimal. The reactions to minerals, you can't live without minerals, folks. You're not going to have a reaction to minerals. And in the event you take something like magnesium and go, oh my gosh, doc, this bothered my stomach so much, and all of a sudden now I'm pooping. That's blaming the good guy. So don't blame the good guy. If you take a little magnesium and all of a sudden you're increasing bowel movements, you probably needed more magnesium. So that's what vitamins and herbs can often do for us. They can help promote health. So we have to recognize those symptoms. Anyways, let's go back to the green drink here. What I want to kind of be mindful here of, let's make sure that we are looking at what's holding us back. Do we have very, very small obstacles that are creating big mountains in our life? For example, does a little bit of taking a green drink inhibit your body from functioning the best it can? Does taking, let's just say 15, 20, 25 supplements a day, a spoonful of supplements, is it, I just can't take that many and you can't do it? Does getting up 30 minutes earlier that difficult that you can't get in and put time in for exercise? So really start to look at the things that are going on in between our ears, the conversations that we're having with ourselves about our personal lifestyles. I promise you, I have them, you have them. There are conversations that we are using, words that we use to others, conversations we're having with ourselves that are justifying very, very small obstacles that are inhibiting us from living incredible, incredible lives. So I'll just give you an example. Get up. If you don't have time to exercise, get up 30 minutes earlier. If you exercise 7 days a week for the next year, you will be a different human being. It's not simple. If you align, if you're not taking supplements and you find out exactly what your body's deficient in, you run labs, whatever it may take, and you find out how to fulfill those deficiencies, you'll be a different human being. If you figure out how to get a little bit more sleep every night by shutting off your phone, you'll be a different human being. And all of those things I just mentioned, maybe they cost a couple bucks here and there, but most of them are just lifestyle and action. So do not let these small little bumps become mountains in your life. So in this scenario with the green drink, small bump, and that you're making into a big hurdle here. And then also do not blame the good guys. So if all of a sudden you start eating vegetables every day, or you're starting to eat, real organic proteins, and you think they're upsetting your stomach, pull back, step back, and recognize what you're really saying here. Don't blame the good guy. Maybe there's somewhere else we can look to make some better improvements. All right, so that was case number 2. That was the case of do not blame the good guy. I got one more for you. We're pretty good on time here, so I'll give you one more here. All right, last one, 19-year-old female. This is a common case. I want us to all pay attention to this, especially if you have if you're a parent, mother or father, and you have youngsters in the house, because I think this in the big picture, I think this is just poor education and kind of going with, well, this works, this is easy, so I'm going to let this happen. And I'm going to call this really the case of, how is your nutrition? So if you've heard me say it before, if you come into my office in person, one of the first things I'm going to ask you, whether you're there for acupuncture, chiropractic, or nutrition, doesn't matter to me. One of the first things I'm going to ask, are you taking care of yourself? The answer is typically, yeah, I'm doing pretty good, kind of good, whatever, or not so good. I appreciate the honesty no matter what it is. It just gives me insight of where you are and how you were thinking about you. The second question, almost verbatim, is I'm going to ask, how is your nutrition? When you say, good, well, it's pretty good, well, kind of, it's that time of year. The next thing I will ask, so we can keep these conversations real, is I will say, what did you eat today? So I have a 19-year-old female. We're going to call her Barbara because I didn't name her yet. So that one, for some reason, came to my mind. We're going to call her 19-year-old Barbara. And I ended up down this road. The question was, how is your nutrition? The answer was good. Pause, and then pretty good. I know that immediately means there's no recognition to what you're putting in your body. What that often may mean that maybe you bypass the second serving of French fries. You put down the extra slice of pizza. You decided not to have one more glass of wine or cocktail. And therefore, in your mind, that might be, well, pretty good. I didn't get totally smashed last week, or whatever it may be. And I might be kind of joking there, but maybe I'm not either. All right. So anyways, so I asked this young girl, what did you eat today? Did you eat any protein after she told me her diet was pretty good? Because I want to create some education along with and very specific questions. And she said, well, because I asked her, what did you eat today? She said, well, remember her answer was, to her diet, how was your nutrition today, was good and pretty good. Her answer to what did you eat today was waffles in the morning. And then for lunch, she had a bagel with peanut butter. And that was the answer. Did you have any protein today? And this is where I'm going to say is, how is your nutrition? We may have to relearn some of these things. And I'm going to put this onus on the parents, because this is a young female that probably her entire life thinking that a bagel and peanut butter is good nutrition. Folks, it is not. It's awful nutrition. That would be nutrition designed, if I was trying to make a diabetic, having a waffle breakfast, and she had a yogurt after breakfast. Waffle breakfast, guarantee the yogurt had plenty of sugar in it. If it was good, like a whole organic, fantastic source of yogurt, probably not, right? It's probably had some sugars in there, made it all yummy and chummy. If I wanted to make you a diabetic, I would start you off with some type of bread with sugar and or syrup. Maybe I'll give you some cereals or toast or bagel. And then after that, I would follow it up a couple hours later with something else that was yummy to keep your blood sugar high. And then for lunch, I would give you another type of, probably some type of flour to spike your blood sugar once again. The fact that she put a little peanut butter on there, do I think it was an organic, whole food, without any seed oil type peanut butter? I didn't get into that conversation, but I'm going to probably make a safe assumption the answer is no. So for two parts of this. One, if you're a parent out there, please just start to educate your kids. The challenge they're having is much greater than most of us. So I'm 54 years old. We didn't have the processed food, the chemicals, the GMOs that they do nowadays. So the diet I just described is a diet directly to lead someone down the road to absolutely hormonal imbalances. And I'll tell you, later in the conversation, those came up. And how and why did I go that deep this morning with Barbara? And the reason being is that your doctor should be looking at your physical appearance and recognizing certain traits that let us know a little bit about your health. We can look at your eye health, how white your eyes are, how clear you look. Is there a good glow there? Look at your skin. So many things about our physical body give us clinical insights of how well you're doing. So if I see certain patterns of acne, listen, we call those hormone imbalances, but they're biochemical imbalances. That means from the inside out, your chemistry is off. And as a result of what you're putting into your body, it's being expressed outwardly what you're putting into your body. And as a result, remember, our hormones don't just decide to go sideways. They are reacting to and responding to the situation and the position we're putting them into. So if we put our bodies in these situations where we're exhausted and we have constant source of shower and high glycemic type foods, tired, sugar and high glycemic foods brought into the body, yes, you will eventually experience hormone imbalances, aka eventually show up, especially in my younger women that are starting to have, kind of more robust hormones. You're going to show up in acne. So this case here, how is your nutrition? Do a deep dive. Everyone listening to this, how's your nutrition? What did you eat today? Was it 100%? So the goal, if you're going to say, man, it was excellent today, this is at the standard. It's 100% organic across the board. But doc, it's so hard. It is, but it isn't. It is, but it isn't. And I would say that because right now you can go to every grocery store, just about, excuse me, and find organic foods. So if you know you're going to eat, kind of like the last case here, if you know what's coming, you can then choose to prepare properly. So I'm going to encourage every one of you that are continuously seeking higher levels of health and the best versions of yourself, physically, mentally, and spiritually, to be the best mom you can, to be the best dad you can, to be the best brother, the best sister, the best doctor, whoever it is that you achieve or desire to be, become that version of yourself. I promise you, nutrition is going to play a huge role. So allow yourself to continue to raise the bar. And it's not that difficult to pick organic grass-fed burger versus the non-grass-fed burger. It's not that difficult to pick a sweet potato versus French fries. So allow yourself to win this by continuously paying attention. All right. So those are 3 different cases. I hope that these clinical insights continue to give you some insights of things that may be important in your life or, lives of people that you care and love for in your life. So keep doing your thing. Keep sharing it out. Thanks for being here today. And I look forward to having you again listening in on another episode of the Health Made Simple Show. Y'all be awesome.